Good evening and thank you for joining us. I'm Riley McManus. High COVID numbers and a resurgence of the flu are straining resources at the Thunder Bay Regional Hospital. Over 50 staffers are currently isolating or off work with COVID. Hospital President Rhonda Crocker-Ellicott says despite those obstacles, she's praising their ability to continue meeting the patient needs. The number of COVID-positive patients at the hospital peaked at 48 on Monday, with 3 in the ICU. As of today, those numbers have fallen to 40 patients who have tested positive, including 1 in the ICU. The overall hospital occupancy is just over 103%, and the ICU is around 82% full. The daily average of patients admitted to hospital who tested positive for COVID was 30 this month. Compare that to last October when the average was 1 patient per day. At the same time, the flu is hitting the city hard right now, during this first flu season since pandemic restrictions were lifted.
It's flu, it's COVID, it's other respiratory illnesses, so that convergence has really caused significant pressure on the emergency department. So the emergency department, when typically would see maybe 250, 260 patients per day, the other day just saw 309. So significant upwards pressure, about 10 to 20% sometimes surges in volume into the emergency department. On top of that, we have high occupancy in our hospital, and we're really trying to catch up the surgical and diagnostic backlog which was experienced through COVID. So trying to catch that up. So all of those pieces put together creates a significant challenge for our organization.
Crocker-Ellicott says while approximately 80% of those patients are admitted for other reasons than COVID, infectious disease protocols are still needed. She says the hospital has significant capacity to handle patient surge, but it could mean deferring elective procedures. And she's encouraging the public to access other services such as telehealth or primary care for non-urgent health concerns.